My vitamin was thiamine. Thiamine is a B vitamin which has functions in the nervous system and the muscular system. They help with the flow of electrolytes in and out of the nerve and muscle cells, and they help with digestive metabolism. Some foods that have thiamine are beef, milk, nuts, oats, orange juice, pork, rice, seeds, cereals, and yeast. And many types of rice that you can find in the store are enriched with thiamine. In adults who are 19 and older, males should have 1.2 milligrams a day and females should have 1.1 milligrams a day. And if a woman is pregnant or breastfeeding, they should increase their thiamine intake to 1.4 milligrams a day. And children under 18 who are males should have 1.2 milligrams a day, and females should have 1 milligram a day. If there's a thiamine deficiency in someone, they have complications within their nervous system, their brain, muscles, heart, stomach, and intestines. And some major thiamine deficiencies may even cause low blood pressure. They're associated with alcoholism, poor nutrition, cancer, vomiting, and hemodialysis. Thiamine is a water-soluble vitamin, so it's hard to have toxicity within the body, and the excess is just excreted within the urine. However, if there is toxicity, it may also cause low blood pressure, and some symptoms include increased pulse rate, insomnia, irritability, weakness, and headaches. My article was about college-level swimmers and their thiamine and riboflavin intakes, and the purpose of the article was to examine the effect of high-intensity physical activity during training on the biochemical status of thiamine and riboflavin in athletes. So the study had 19 athletes, 6 men and 13 women, and they underwent swim training and dry land training. And the design of the study was split up into 2 periods. They had one 9-day preparation period where they underwent a lot of tests, so they had their heart rate and blood pressure taken, and then a 7-day intensive training period. All these members of the study were collegiate athletes, and they underwent 16 hours a week of swim training and then 10 hours a week of dry land training for 1 year. And each athlete had a different personalized swimming training protocols that they had to follow, which included arm strokes, leg kicks, and then whole body swimming. And part of the study was that they had to record everything they ate for at least 3 days, and 2 of those days had to be training days and 1 day had to be a rest day. The results of the study showed that concentrations of thiamine during intensive training period decreased significantly, and the data showed that the concentration of thiamine decreased during the intensive training period, which included the swimming. No significant changes were observed in the dietary thiamine intake, though, so it showed that athletes need to take in more thiamine in order to maintain that level. And there were no significant changes found in the basal metabolic rates of the subjects. And then the physical activity of the females drastically increased while the males only had a slight increase, which indicated that the increase in the estimated energy requirement was a result in the rise of the energy expenditure during swim training. So to conclude, thiamine doesn't enhance athletic performance, but it allows athletes to get less fatigue, and it decreases muscle weakness within an athlete.